Vasectomy is a safe, simple procedure that makes a man permanently sterile. In other words, he will not be able to father a child. To perform a vasectomy, the surgeon feels for the vas deferens, the tube that carries sperm, under the skin of the scrotum and holds it in place. The scrotum is numbed with a local anesthetic. The vas deferens is brought through the skin and cut. The surgeon may use clips or ties to seal the opening, which prevents sperm from entering the semen. There is little discomfort with the procedure, though some men feel a slight tugging sensation. You may need stitches to close the incision, but this will be determined by your surgeon. The procedure generally takes less than 10 minutes and is performed in the doctor's office or, in rare circumstances, in an outpatient surgery center. In preparing for a vasectomy, the provider will go over your health history and perform a brief physical examination. Please tell the provider if you have any of the following: a history of excessive bleeding or blood disorders, allergy or sensitivity to local anesthetics, such as the cane drugs or antibiotics, any skin diseases involving the scrotum, especially infected pimples, any injuries or earlier surgery on the genital organs, and a history of urinary tract or genitalia infections. Be certain that you want to have a vasectomy. Vasectomy is considered a permanent means of birth control. If you are undecided, you may want to consider a non-permanent form of birth control, such as condoms or oral contraceptive pills. At this time, vasectomy is the only approved form of birth control for men. For the week leading up to your vasectomy, do not take aspirin, blood thinners, or NSAIDs, such as Advil or Motrin, unless the doctor says you may. Taking these medications increases the risk of bleeding. The night before or the morning of the vasectomy, shave away the hair from the entire scrotum with a single-blade disposable razor. Remove the hair around the base of the penis, including any pubic hair that seems to fall onto the scrotum. Do not use an electric razor on the scrotum. To reduce the risk of infection, thoroughly wash the scrotum and groin the day before and the morning of the surgery. Before the procedure, take any preoperative medications as directed. Bring a clean athletic supporter or tight pair of jockey shorts to the procedure. You may want to wear loose-fitting pants. For office procedures, we recommend that you have a light meal within 2 hours of the procedure. Patients can drive themselves unless they are told not to. It is normal to have some discomfort and swelling in the scrotum after a vasectomy. However, if you have an unusual amount of pain, a great deal of swelling in the scrotum, or continued bleeding or fever, call your doctor immediately. Here are some other things to pay attention to. If you have any mild discomfort, you can take acetaminophen, such as Tylenol, every 4 hours. Ice packs or a bag of frozen vegetables placed over the scrotal supporter and dressing may provide relief as well. Use ice packs for the first 36 hours to help keep the swelling down. You can expect a small amount of oozing from the wound. The doctor may place a small dressing, which you can remove the following day. You can start bathing or showering the day after the vasectomy. To dry the scrotum, use a patting motion rather than rubbing with a towel. Sometimes the skin will separate because of oozing blood or body fluids. You can pinch the edges together with sterile gauze and your fingers. This will bring the skin together and allow it to heal. Sperm can remain in the vas deferens above the area of the procedure for weeks or even months after a vasectomy. A semen test is done 3 to 4 months after the procedure. This test is a semen specimen that is sent to the laboratory. On some occasions, the semen test is repeated. Until then, you must continue to use birth control to prevent pregnancy. Vasectomy does not affect the production or release of testosterone, the male hormone that is responsible for a man's sex drive, or any masculine traits such as facial hair or deep voice. The operation also has no effect on sexuality. Erections, climaxes, and the amount of ejaculate remain the same. The only difference is that your semen will no longer contain sperm. Men who have a vasectomy are no more likely than other men to develop cancer, heart disease, or other health problems. In addition to pain or bleeding, minor complications of a vasectomy include the following: A sperm granuloma is a hard, sometimes painful lump about the size of a pea that may form if sperm leaks out of the cut vas deferens. The lump is not dangerous, and the body usually takes care of it. Congestion is a sense of pressure caused by sperm outside the vas deferens. It may cause discomfort for a few weeks after a vasectomy. Like granuloma, congestion usually goes away over time. In less than 1% of patients, there is continuing discomfort. You can go back to your everyday activities the day after surgery. Try to avoid unusually vigorous activities. You should be fully recovered from the procedure within 10 days. You may resume sexual activity after a week following a vasectomy. However, you should continue to use reliable birth control methods until your doctor's office informs you that the vasectomy was a success. If you have any questions, please ask one of your caregivers. And thank you for choosing Cleveland Clinic for your care.